I hope to give you an overview which is useful enough for you to understand a little bit what we talk about when we talk about citizen science and how can citizen science improve your research. A few words of personal preamble, just to say that I'm a pediatrician and a clinical researcher. I've had training in tropical medicine and international health and in epidemiology. And I've been working in an institution called ISGlobal in Barcelona, and also in an institution called CISM in Manisa, Mozambique, where I've conducted for the past couple of decades most of my research. I'm very interested in the translation of excellent research into impact, and that's where the citizen science plays a little role. And I've been very privileged to be leading my institution since January this year. Sorry, my reality and how I like to describe myself is more as a clinical researcher working in settings like the ones you can see in the picture. And that's the kind of researcher that I still hope I can be. And the kind of research that I do is very much related to pediatric infectious diseases in low and middle income settings. In settings which have no addresses, in settings which look like the one in the picture, and therefore in settings where citizen science has even more reason to be applied to understand or capture the feelings of the community where you want your research to have an impact. So let me start by describing a little bit what we consider citizen science, or what are the general definitions. And citizen science is in effect creating knowledge between everyone and for everyone. I've taken many of the definitions and some of the information from this webpage, which is a European-led citizen science initiative, and feel free to look into it, because I think there are many examples of good citizen science explained there and many resources that you will find very, very useful. So what is citizen science? It is any activity that involves the public in scientific research, and therefore has the potential to bring together science, policymakers, and society and the public as a whole in an impactful way. Through citizen science, all people can participate in many stages of the scientific process, and those stages include from the very design of the research question, the collection of data related to the research question, volunteer mapping, data interpretation, data analysis, and even publication and dissemination of results. And citizen science in itself is also an approach of scientific work that may be used as a part of a broader scientific activity. You will hear throughout my talk and throughout Begoña's talk later on lots of the word co-creation. That's an important component of citizen science, and it's nothing else than asking the public, the general society, to also co-create together with you how you will intend to answer your research question. And citizen science is, in my opinion, another mechanism of translating research into a more tangible impact. It's obviously not the only one, but it's one mechanism, and that research funders increasingly recognize as important for that translation into impact. We understand citizen science as a scientific research carried out partially or completely by amateur or non-professional scientists, by the general public. It is possible thanks to the participation of hundreds or even thousands of people, volunteer people. The citizen has a key role in collecting the data, not only in collecting, but also in interpreting it. And some of this research reaches the scientific quality to be published in high-impact journals. And just as a highlight of things that can be done, here are some examples that typically mentioned when you talk about citizen science. The citizen can participate in cleaning up the planet, in monitoring air quality, in saving a species, in uncovering history. For example, when you write up your CAPTCHA, you may also contribute to writing up or translating into written digital work things that don't exist as written, no? Translating written words coming from images into written words, no? So these are just some examples, but I will use some examples that we conduct in our institution that you will think are more interesting. To qualify as a project that includes citizen science, you must satisfy at least one of the following 4 levels of citizen participation. The first one would be crowdsourcing. Citizens capture or process data. The other one would be distributed intelligence. And citizens here are used to interpret, to help you interpret the data. You have participated science, where citizens participate in defining problems, challenges, objectives, and also in the collection of data. And then collaborative science, where citizens design together with scientists the research that is going to be carried out. In addition, research groups must inform citizens who participate in the set of experiments and or field work about the results of the research. It's very important to involve them in the creation, but it's even more important to involve them in the dissemination of the results, no? And having them participate in the collective interpretation of whatever you have achieved through your research. The objective, of course, is to bring the results and the research process closer to the non-expert citizen and in a more digestible way, so that the citizen can understand. Of course, you could share with them the paper, the scientific paper, but the scientific paper is not something that is easily digestible by the general citizen. So you have to bring down the technicalities and make them understandable by the general citizen. Projects, to the extent possible, must obey an open data and open source policy. Of course, you want to reach as many people as possible, and researchers need to ensure that the research has a social and socio-environmental impact. That's, of course, part of the wish list, and that should occur. There are different degrees of participation. In the y-axis, you go from no participation in the bottom to high participation, and in the concentric circles, you go from to inform, to consult, to involve, to collaborate, and finally to empower. No? And to empower a citizen to participate in your research is to ask them to co-create with you that research and to co-interpret with you. That gives that citizen power to actually feel that they have contributed to the creation and the interpretation of the research. The impact of citizen science, obviously, it has a transformative potential or effect in 3 dimensions. First, it raises and makes visible and socializes and supports problem solving, and it does so in a collective way. It also transforms citizens, not only at the individual level, but also at the community level. And it triggers, hopefully, changes in habits and increases consciousness about the given problems. And it can transform, societies by fostering implication and institutional commitment. Let me use some examples of citizen science that we do in our institution, and you will understand better what you can achieve with citizen science. This is a first example called Project Mosquito Alert in Barcelona. And in terms of Mosquito Alert, what we notice is that Barcelona is the city in Spain with the largest population of tiger mosquitoes. You know that tiger mosquitoes are the highly nuisant mosquitoes that bother you during the summer, typically, but that they can also transmit infections that can cause disease in humans. For example, diseases like dengue, Zika, chikungunya, where we had several hundred cases in Barcelona, most of them imported, of course. But if you have the mosquito that can actually transmit these kind of infections, and you have the virus or the pathogen that can transmit these human diseases, you could reestablish potentially the cycle of transmission. So this project, what does it do? This is an app that citizens download in their mobile phones, and they can take pictures of the mosquitoes and also help geolocating them. I'm sorry, because I don't know why the slides are moving on their own. This is a bit magical. What we have achieved with an app like this is the possibility of locating the areas with the highest density of tiger mosquitoes. Of course, in the other side, in the recipient side of the pictures, we have entomologists that can actually interpret those pictures. But at the end, the app allows anyone to notify through a photo the possible discovery of one of the mosquitoes of interest, and as well as their breeding places in public spaces. That's where the entomologists come. They interpret, validate the pictures, and we can publish this as part of an online map. And at the end, this information gathered through citizens, voluntary citizens, what it will do is it will complement scientific work in the surveillance of invasive mosquitoes, and it can be used by public health managers to monitor and control those mosquitoes in neighborhoods and cities. In Barcelona, since the year 2017, the project is one of the key tools of the Barcelona Public Health Agency for the control of the tiger mosquito, and we are now in the process of expanding this to other European cities. This is a second example of citizen science. This is called the Vitoria. Vitoria is a city in the north of Spain. Vitoria-Gasteiz Green Capital. This is a project where there are 13 active citizen science sub-projects, which have different objectives, such as, for example, the conservation of different plant species, the monitoring of urban and nocturnal birds, the monitoring of butterflies, and creating a census of invasive exotic species. This project has been very well received by the citizens of Vitoria. We have 120 super active volunteers that are involved annually, which have a loyalty of 90%, which is very high loyalty. They remain committed to participating in a project like this. And this project has allowed the transfer of knowledge to environmental organizations and local and regional government. It's just as one example of what one of the 13 sub-projects does. This is the program called Orchid Conservation Program. It is one of the first programs to be created, running since 2013, and what it has achieved is to map the orchids that are present in the city, in the municipality, and defines and monitors plots based on species richness. It can carry out population censuses to evaluate the state of conservation, follow up the life cycle of the flowers, identify pollinators, etc. All based also on the volunteers, which are actually taking pictures of the flowers in the city. This is another project called the Library Living Lab in Sant Cugat del Vallès. Sant Cugat del Vallès is a city in the periphery of Barcelona. This project seeks to co-create the digital cultural heritage of the town. In this case, the citizen, what it does is that it takes a picture and scans the capitals in the columns of the architecture of the churches or the town's monasteries. And after processing these groups of photographs, the capitals are printed in 3D and then left on display. It also adds a free access online library, so people can consult it online and study them online. In fact, what this project does is it democratizes access to knowledge and innovation in a topic which is super specialized, and you wouldn't have natural access to it. This is another example called Stick Out Your Tongue, Saca la Lengua. This is a citizen science project that aims to study the mouth's microbiome and its possible relationship with our environmental characteristics and lifestyles. We've done different runnings of this project. In the first run, we contacted 40 plus schools and involved over 1,500 samples obtained from the saliva and the mouth of the volunteers, which are kids 14, 15-year-olds of age. We organized with schools, universities, and the general public a contest to analyze the data that we obtained through the microbiome analysis of those samples. We proposed different challenges at different levels, and including statistics, data visualization, bioinformatics, all involving the citizens after collecting these samples. We did a second running of this project that finished in 2019. Once we had a clear picture of the oral microbiome's diversity in healthy teens, we wanted to compare it with what happened a few years later and compare to the changes in the microbiome diversity, looking also at the microbiome in adults and vulnerable population groups, such as individuals with Down syndrome, cystic fibrosis, anorexia, celiac disease, etc. So another very complete example. I've also chosen to put this picture to try and bring a little bit the topic of citizen science to my own environment of research, which is Sub-Saharan Africa. This is a council of elderly people in a rural area of Sub-Saharan Africa, where we also bring them together to present the research we want to do, to get their feelings and understanding about what we plan to do, to get their feedback about whether they consider we are approaching the project, the research project, irrespective of the topic, in the right way, particularly for community engagement and community acceptance. And once we receive their feedback, we can redesign our standard operating procedures, the way we have framed our project. And as I have said before, doing community engagement and involving the citizen in the co-creation and design of your research is even more important in settings where there is less habit of conducting research. We've used this kind of approach for a very large project on conducting post-mortem sampling in children that have died in sub-Saharan Africa, without the great advice provided by the elderly, the community leaders, the religious leaders. We wouldn't have been able to do to conduct such a sensitive research topic like the one we've done. Let me also talk around a project called Cities and Health. This is a project conducted in 5 European cities who designed and carried out experiments to explore how pollution or other environmental conditions in their environment, in their specific environment, affect their health. The project created a set of interactive tools with personalized elements and best practices in citizen science to be able to propose and replicate studies in other places by researchers and citizen groups. For example, the 5 cities that were involved dealt with different topics of interest. Barcelona dealt with air pollution and health, Utrecht with biomass burning and health, Ljubljana with noise and health, Lucca with industry pollution and health, Kaunas with physical activity, urbanism, and health. And for example, in Barcelona, we organized a specific pilot project within the framework of the Researchers' Night, which is an activity where we bring together scientists with the society in an open museum night, one night a year. We launched together the pilot project with citizens. In this session, participants proposed research topics on the effects of air pollution on respiratory and mental health and provided possible solutions to implement. We conducted a survey to actually understand what was the priority of the citizens in terms of what we wanted to respond. In case number 1 priority provided by citizens was how does air pollution in combination with noise and green space availability influence mental health in our city. And that was the research question that was framed, and that was the question that we tried to respond together with the citizens that had participated. As part of this large project also, there is the topic called Vigilantes del Aire, those that look after the air. Here we distributed strawberry plants that were left in the houses of volunteers for 3 months. After those 3 months, we collected the leaves of the strawberry plants, which is a particular plant that has the capacity of retaining very well when exposed to heavy metals. And we dissected those plants and analyzed the impact of heavy metal circulation and in the plants, which can give us an idea of how the air is contaminated or not in relation to living in a determined space. We also conducted, as part of this large project, studies on how noise affects our health. It is very much underestimated how much noise can affect our health in many aspects. But a study carried out in Barcelona estimated that noise in the city causes as much illness or even more than air pollution, which sounds counterintuitive, but it's actually true. We also conducted studies about noise and its impact on education. For example, school children present behavioral problems due to exposure to noise and air pollution from traffic around school, according to the study we conducted. Also, the relationship between traffic noise and attention deficit and hyperactivity disorder, where we were able to trace high noise levels with a higher incidence or higher relation with attention deficit. And this is obviously possible when you involve the citizen and you collect the data together with them. And that obviously allows you to also design strategies and also involving the citizen, design strategies on how specific urban planning can play a key role in reducing the pollution or the noise levels and promoting healthier lifestyles. And I will not go into the details, but this allows us to map the problematic spaces, to design tailored action plans in those problematic places, and try and influence the laws and the regulations so that you can minimize the harm caused by the problem that you're actually studying. There are many resources to design your own citizen science project. From our own citizen health project, we have created a toolkit that can be accessed online and can help you co-design key aspects of the study protocol, ask what decisions participants want to make through the decision-making canvas, or democratize decision-making processes. So plenty of resources. And here I've added additional resources, free courses, an observatory of citizen science, a green book on citizen science, or the EU citizen science resources that are available, freely available online, including books like the one I show here. I think I'll stop here and I'll stop sharing my screen so I can see your faces. Again, allow me to apologize as I'm not really an expert on citizen science, but in our institution we conduct and we have the mandate of including as much citizen science as we can. Remember that in most European projects or in most big grant opportunities, you are increasingly requested to include citizen science components. And it's not just ticking the box, it's actually thinking in a strategic way how you can improve your project by involving the citizen at all stages. Remember, it's not only communication, reactive communication is a more proactive involvement of the citizen that can help you frame better the research question, design better the way you're going to be collecting the data, involve them in the collection of data, involve them in the interpretation of data, involve them in all other stages of the research. And I'll shut up here because I thought.
Thank you so much. This was really very interesting, and a lot of diverse projects and ways that you can engage public into your research. I have a question. In the project that you had with the microbiota of the tongue, it was obvious that you went to school, so you engaged students. In the other projects where they were more public, like the one with the orchids or the mosquitoes, can you just give us an idea of the percentage of adolescents that want to take part?
It depends on the topic, of course, but in general, when you actually make it easy for teenagers to participate, they are very willing to participate. I think Begoña can explain her experience also, because I didn't want to make any spoiler on the second topic of the presentations today, because that's a very targeted project in teenagers, no? But in general, they are very willing, as long as you make it sufficiently interesting for them to get engaged. If they understand the purpose and they like the topic, they will be loyal participants that will remain participating for a long time. Of course, there are topics that are much easier to involve older participants, but in many ways, entering through schools is a very good strategy, because students always like to do something different to the normal routine of classes. So and often if you find a teacher that is a good entry point to that school, their participation is going to be even better, because the teacher is the one that triggers the interest of the students.
Yes, and especially for like obesity and exercise, that has been used, to my knowledge. Yeah.
Thanks, Vana. We have a question in the chat from Noella, who asks, how do we use these techniques in healthcare? It's quite a big question, and we haven't got a huge amount of time, but maybe a few pointers would be great. I know you touched on some nice examples in your talk.
Depends very much on the topic, but for example, you can involve the participants in understanding how they interpret a given disease, how they interpret the reception of results related to a given disease, how they would like to have research conducted in that specific topic of disease. Begoña can explain very well, because she has a council of patients, pediatric patients, that actually help her revise the protocols of research studies. So therefore, if you have a patient, for example, a cancer survivor, which is a teenager, that reviews a scientific protocol, which he may not or she may not understand the technicalities of it, but will understand the human side of how you're going to be involving participants, they can provide extremely useful knowledge. And in terms of healthcare, it's the same. For example, if you involve the patients of a given disease and they tell you, well, I don't like to have a bone marrow puncture done without having a full anesthesia, without having any given particular preparation, they can give you hints on how you can improve their approach to that specific disease. And without the patient participation, you may not actually understand where the problem lies. No, so I would say there are many ways. It is very much dependent on the specific topic of research and or the specific disease, but there are many avenues where you can receive the feedback and immediately incorporate it into changing habits and practices that may not be well received by the participant.
I'm going to distribute my presentation in three big topics. The first one is to explain you the aim of this project, which is the unmet need that we wanted to cover when we designed this project. Something that is relevant and important that you know is that we designed this project with Dr. Quique Bassat and the rest of the team just at that moment in which the COVID-19 pandemic was in the big explosion. And I think that it makes sense about what we designed at that moment, and also it makes sense about what we have delivered and we want to deliver in the future. I'm going to speak also at the end of my talk about the continuity and the sustainability of this project. Secondly, I'm going to talk about the educational program, because what we did is to design a project based in the importance to educate the young people and of course the teachers. As we have mentioned, teachers play a key role in this project, but also in general in any citizen science initiative that you want to do with teenagers, because it's the right and the easy way to be in touch with young people interested to perform a citizen science project. And in this
Begoña, sorry to interrupt, but have you moved your slides, because we don't see slides moving?
Okay.
So maybe you should, maybe we should try again.
Okay. Begoña, I can share the slides on my screen. Can I?
Yeah, let's do it, please. I don't know why it's not working. Sorry, technical issues. I have a new laptop and some probably things require some adjustment. If you can share, Mateo, the slides. I was just finishing the second one that explains the 4 pillars of my talk. You can move forward. Perfect, thank you. About the unmet need, if you move to the next slide, as I mentioned, this project was just designed at the very beginning of the COVID-19 pandemic. And we thought that was a social responsibility as a researchers to deliver some solution that help us to prevent and to manage the pandemics. Of course, the teenager population, that they were, for a long time in the lockdown, and they receive a lot of input and information on the social media, on TV, and from different means. And what we thought is that even in the schools also they had some content and some activities. What we thought is that probably they were using conventional pedagogical methods, and our aim was to move them to change their behavior in order to prevent the pandemic. And based on this challenge, what we thought is that the key format to educate and also to involve also the young people in the prevention and management of pandemics was using, in one hand, gamification, and you will see how we address this, and on the other hand, citizen science, because they have a lot of data, information, and preferences, as Dr. Quique Bassat mentioned, and this is gold for researchers, and we can take advantage of their contribution in science to deliver other initiatives. Next slide. As I said, the Science for Pandemic approach was based in this collective problem that was the big COVID-19 pandemic, and thinking in a unique collective also solution involving, the citizens in this solution, in this educational and collaborative approach, based in a pedagogical format that the name is behavioral change. What we wanted was not only to train the young people, it's to change their behavior to prevent, the spread of the disease, but also to involve them in research because they have, a big say in any of the activities that we do in research centers. In this case, in infectious diseases, but we can, extend the same approach to any other therapeutical areas. In some cases, what we need to do is involve per se the patients, but in other activities, of course, like infectious diseases and pandemics, the key players are the citizens in general. Next slide. Based on this, of course, we had two challenges to solve. One is the control and the management of these infectious diseases, and the other one was related, to deliver innovative formats to educate the young people in the topic. And for us, the key solution was a gamification experience based in the simulation approach. It's not a game only for entertainment and to play and have some free time. It's a game to educate and explain to the young people that any action that you do during a pandemic, even if you are a citizen, even if you have any other role, because in the game the players they can have several roles, has consequences, and as better we can manage the resources and the prevention actions, of course, probably we can stop the process to split the pandemic and have a more healthy society and population. This is so important, and you will see afterwards that we did a lot of work of research to incorporate this information in the algorithms of the game and be sure that the game was based in scientific and science based data. Next slide. Let's talk a little bit about the educational program. If we move to the next slide. As I said, it has two pillars. The first one is the opportunity to involve young people in science, and we did in the second year of the project. We are just in the third one. Two pilot projects based, in scientific questions that we know in advance that the young people can help us to find the answers, to learn about the problem and to identify solutions. And the second area in which we were working was in this educational program based in the simulation game and in this behavioral change intervention. And to do this, as I mentioned previously, it was key to work with the schools, to educate teachers and involve them in different kind of activities. Next slide. To deliver the educational content, that it's the gamification experience, we co-create them. One pillar of any activity of citizen science that also you can perform in your project, it's to involve the citizens, in this case the young people, in the design of the solution. And in this sense, we deliver different workshops with young people with the prototype of the game to be sure that how the game was addressed, the storytelling, the narrative was easy, the interactions, and any adjustments that from the user experience were required. We work in this direction. Also, it's so important to put on the table when you design these kind of initiatives that they provide, in this case, the expertise of being, teenagers that are the target population of our educational program, of our game, but also, they are very active players. And in this sense, was an asset to learn also from them and to see, what they expect about this kind of educational program. And for us, deliver the game and also deliver these two use cases was essential to have the final version of the game that I will explain in few slides, but was focused in 5 infectious diseases and in different scenarios, because this game it's based in a in a situation in which the players, they need to take decisions in the context of a city. Next slide. What makes unique in general this project is that on one hand, has this important pillar about education and research via gamification. This is innovative. Usually these projects of citizen science basically, involve the citizens in the design of the research question or the protocol to collect the data, etc., but not always deliver an educational program to educate them in the field. And sometimes it depends of the topic of the research. It's important to prepare the young people to be engaged and to participate in the research. Of course, it's centered in the citizens, in the young people. As I have mentioned, they have been in the co-creation process, and they have been, the main asset to get the data and do research. The data for us is the asset of the research. In the 2 pilots, at least that at that moment we have performed, the information that we have used to do research has been data, but also for future projects, the data can be, complemented, for example, with information that we can collect from biological samples, as Dr. Bassat mentioned, in some projects, or any other source of information than the citizens can provide to us. It was focused, as I mentioned, in more than one infectious disease, and it means that you can train the young people in the prevention and the management of pandemics beyond COVID-19, that was, the common pandemic in Europe in other diseases. It has a multicultural approach, and in this project we have involved different stakeholders, even pharma companies, because they play an important role in this case to deliver vaccines or treatments for these diseases. Next slide. These are the learning outcomes. I'm not going to go much into detail, but for us it was really relevant, and it was connected with one of the case studies or the research projects that we did in the second year, to work a lot in the importance of the prevention measures, and also specifically in the topic in regards vaccine, because as you know, still we have some reluctance and hesitancy to receive vaccines, and we thought that this was a key objective for all of us. Next slide. Let's talk a little bit about the game. If you move to the next slide. These are some screenshots about this gamification platform. As I mentioned, it's covering 5 diseases in different, cities from different islands, and you need to face different situations, also considering the role that you want to play. As you can see in the slide, you can be a researcher, you can be a journalist, you can be a politician, you can be a citizen, and according to this role, you need to be involved in different diseases. You need to manage your decisions also in terms of the time and the resources, because you have some budget to have interactions on the game. Next slide. Here you have the information about the scenarios, the places where the citizens are located. We wanted to have, let's say, a global vision of the pandemics, and also considering that some pandemics are not, as you know, focused in Europe. And in this sense, we had the North, South, and Central America represented, the North, Sub, and Saharan Africa, Europe, but also Asia and Oceania. As I said, it's a simulation model, or a serious game design, in this case, based in scientific data. And the 5 infectious diseases that this game includes are beyond COVID, HIV, cholera, malaria, and Ebola. Next slide. Another one, thank you. Perfect. Beyond the general game, also we included several mini games to train and to inform specifically about, the anxiety that it's connected with the management of some symptoms. Something that also is really important in the context of a pandemic, that it's the process to differentiate if new it's scientifically based or not. And in this case, we have also a game about fake news, the importance of tests and quarantine and related to the eco-stress. And finally, again, we have a game specifically focused in the adherence and the importance of vaccination. Next slide. This is an example about the mathematic model or the algorithm that it's behind of every disease and every scenario. We collect data with the very hard work of the team of Dr. Bassat from scientific papers, research projects, etc., to be sure that in any interaction in the game, everything that happens after this was, like in the real world, because what we wanted to keep inside of the game, it's, the potential scenarios that probably in the future you need to manage if you live in a specific pandemic situation of one of these 5 diseases. I'm not going to go much into detail, but it's important that you know that beyond the look and feel that requires designers, we have had also the programmers, but it's key the role in this game of the experts, the researchers and the medical experts in infectious diseases, that they collected all the scientific data that helps to manage all the interactions of the players in the game. Next slide. These are some examples about the information that we collected, of course, about the life cycle of the disease, which is the agent, the mean of transmission, the clinical characteristics, if we have some diagnostic tools or not, if we have vaccines, the effectiveness of these vaccines, or in some cases also the treatments, etc. This is only one example. You can see in the slide the HIV information. In the next one, I think that we have a second example, if you move to the next slide, that it's about malaria. It's the biggest scheme, because underneath, of course, we have all the data and the numbers and, of course, the mathematic model. Next slide. Let's talk a little bit about the piece of research, citizen science, and in regards of the sustainability about the tools that we have designed in this project. As I mentioned, there is a big pillar that it's education, that is this serious game, this gamification experience. But the other pillar of this project has been the research. And in this sense, we have in the same platform the game, but also the tool that allow us to do citizen science based on a website, on an online tool in which we can create specific questionnaires. The layout, it's, close to the environments where the young people used to interact. In this sense, social media, it's familiar, close the layout to Instagram, in order to make as much friendly the process to contribute to these questionnaires. Of course, it's not a naive project. We are not asking to the young people, please complete the questionnaire. We do this training and this capacity building program with the involvement of schools and teachers. And I think that this is the asset and part of the success of the project that we have done in the Science for Pandemic project. Next slide. Also, another example, this is not related specifically about, the involvement of young people, but it's a kind of service of art or activity that we can deliver. And it's an initiative that we are working at that moment, that it's to analyze the impact and the experience of the participants in a specific clinical trial for the COVID-19 vaccine. In this sense, also, we have used the tool of the citizen science initiatives in Science for Pandemics, in this case, to collect the data from 150 participants in this questionnaire. And also we are analyzing this information, crossing the data from individual semi-structured interviews that we are at that moment finishing with 30 participants. Next slide. This is the process in which we design and we deliver the projects, depending, of course, of who is leading the initiative. Also, we can help in the study design. Already, Dr. Bassat mentioned that in our institution, Sant Children's Hospital, we have a youth council. It can be a way to involve specifically young citizens in the design of any research initiative in which we need to also have their participation to collect the info. But there are, other ways also through schools. And once we have this project design, we work with the implementation in our Science for Pandemics platform to be able, as I mentioned, through these questionnaires to collect this data. In this project, we have a team of experts beyond the medical setting. We have experts also in statistics and analysis of clinical information. And at the end of any project that we can manage in our platform, we can deliver a final report with the data and the analysis and the interpretation. Next slide. This is another example. I have mentioned about the importance in the game, but also in general in research, to learn from the young people about the vaccine hesitancy. And in 2022, we delivered a project in which we involved close to 2,000 young people to answer a questionnaire that helped us to analyze the main reasons about the vaccine hesitancy. In this case, we involved participants from Poland, Italy, Portugal, and Spain. And what we saw, as you can see in the slide, is that the young people from Poland and Italy are more reluctant to get vaccinated than the young people from Portugal or Spain. This is only one of the items that we analyze. Also, we saw that gender or the age, it's not related with the hesitancy. There are many other elements that also we analyze. Next slide. As you can imagine, have this data help us to design future health promotion activities or educational programs. The idea is not only do research project and to publish the outcomes, is to see if with this data and this information coming from the young people, in this case, the young citizens, we can also design future interventions. And as I mentioned, this project was designed just at the very beginning of the COVID-19 pandemic. And of course, nowadays, thanks to the vaccines, we are living a different reality of this condition in Europe. And what we wanted to do in the project is to spread beyond the topic of infectious disease, our capability to include, the topic of citizen science in other kind of research initiatives. And at that moment, we are able, because we have, as you can imagine, as an academic research institution, and also with this partnership with ISGlobal, the institution that Quique Bassat is leading, we have the capability to cover other topics beyond infectious diseases. And we want, of course, to offer to the scientific community our tools to work in general in health pediatric topics. For example, there is an Italy's in Spain to analyze and to learn from the young people about the addiction to cannabis, because it's increasing a lot, about mental health problems, etc. And this tool, this platform, it's ready and open for business and to support other initiatives beyond the ones that we design during the lifetime of the project. Next slide. Some other examples, I just mentioned the cannabis problem that we have, but also there are problems among the young people about the screen abuse, of course, sexual transmission diseases that, at least also in our country, it's increasing basically in the boys group of population, but these tools can be apply and be used in other topics related to health, for example, the rational consumption of water, the antimicrobial resistance, and other topics. Our focus and our expertise is in children and in teenagers, but also in some topics, also it's important to involve the parents. I have not mentioned, but for the vaccine hesitancy project, also we involved a large number of parents to see if the information coming from one group and the other was similar or not. Next slide. And yeah, I think that it's important from the scientific perspective, everybody working in academia, about the value and the benefits that it has, work with the young, in this case, young people or the society, because also they can help to identify health-related topics, health problems. And I think that, as this news said, the society at the end, it's the barometer, and we need to work from the very beginning of the concept of our research, and of course, until the end, close to the society, and they can play an important role in our initiatives. And next slide. only to summarize, the services and what has been designed and delivered in this project, and at that moment it's open for any research institution interested, is the game that I already mentioned. That of course this is focused in these 5 specific conditions, but it can be scale up to other diseases if it's necessary. We also have the capability and the expertise to deliver these educative units, these pedagogical programs to teachers and young people. And of course, the third one, that it's for us the most important pillar, are all the tools and the expertise that we have generated in citizen science projects. Next slide. And yeah, only a final thought, it's that the young people and the society, they can be game changer. They can help us to do better our research. And I think that it's so important to have on mind projects like Science for Pandemics and the other examples that already Dr. Bassat mentioned, that are very focused in the involvement and the contribution of the society or specific groups of population. But in general, in any of your research, I think that always the patients or the society can play some role. And here we are open, to help in any project or initiative that you can have focus in this topic of patient and public involvement. That is not the topic of our webinar today. Thank you so much.
I can start by asking you, I understand that through social media, you improve the awareness of the people around you and increase sustainability. Have you discussed with your education minister about the ways that you could find to increase sustainability and have programs in schools using this experience?
We have had some conversations with regional governments, not the minister, because it's country level, and as you can imagine, it's not easy. But we are very close to different regional or city governments, because they are, of course, aware about the problems that they can have in their territory. And for us, I think that one important asset to perform citizen science is that they can help you to know the problems that you have in your specific, region or city. We are at that moment in some, conversations with this government. And also for the topic that I mentioned, that in Spain it's a big problem because it's under discussion, the legal access to cannabis. What we had was a very close conversation with the Scientific Society of Doctors, in this case from the region of Barcelona, because they were aware about what can mean this open access for the consume of cannabis, and they were interested to see if we can deliver some prevention programs, basically to educate the young people about fake news, because there is a lot of misinformation and fake information in regards of the consume of cannabis among teenagers. And hopefully soon we can start a project focusing this health problem.
Begoña, I was going to ask, because many, obviously you've been focusing on children and adolescents, as you were saying, but a lot of young adults do gaming, etc. And I was wondering about, in terms of, other applications for them, in terms of what you were talking about, sort of repurposing this science for pandemics to other health issues. Is that an area that you're looking into, or are you wanting to stay more focused on children and adolescents?
No, we are open to work with any group of population that can, provide value for any research project. As I mentioned, for example, in the vaccine hesitancy, we used the same questionnaire, same questions with the young people, but also with their parents. And this is not, let's say, young adults, but it's, the adult population. It's a tool that has been designed, tested, and implemented specifically during the lifetime of the project with the young people, but it's accessible and, it can be used in young adults and, of course, in adults.
Mm-hmm.
It's not, we cannot do it with... Yeah.
Sure. And in terms of obviously a huge amount of work goes in. You shared with us about the research and the science that goes into the game to make sure that it's embedded in, you know, what's known. But how, in terms of pivoting to other conditions, or can you give us an idea of how much time does it take in terms of doing that, you know, the research and the programming? Is there, presumably it's quite time intensive?
Yes, it's time intensive. It requires, you know, some months. Of course, it's not the same to create from scratch the game, because we had plenty of meetings about the storytelling, the scenarios, which is, this is, of course, it was easy for us to say, okay, COVID needs to be in the game, but also which other diseases, thinking, you know, in different means of transmission, that diseases have vaccines or not, because at the end there is a pedagogical, you know, objectives behind every condition. It's time consuming, it's long time, but also based now in what has been delivered, include a new disease in the game, it's feasible. And I think that it's not going to require the same time if there are commonalities with the other ones. It can be considered. Also, I forgot to mention that it's a game that it's accessible not only in Spanish or English, also in Italian, because our colleagues from Penta, they are part of the project and they help to translate into Italian, in Portuguese, because the team that has designed this game, it's based in the University of Coimbra in Portugal. And also, if, you know, for some projects or initiatives, it's required to have the game in other languages, this is a very short time of investment and resources, because we are able to have this game in other languages, because also we know that not everybody in Europe is competent in English. And if there is, you know, any educational program or research initiative focused in one specific country, we can adapt the language and include another one.
Great. And that's what you were meaning when you were talking about the game being multicultural.
Exactly, yeah. But about also the, you know, the roles, you know, the gender, you know, we have tried to be very inclusive in the process about the characters and, you know, the scenarios of the game. But of course, in terms of the language, because if we don't, you know, include new languages, probably we are making not accessible for some, you know, young people, the game.
Sure. And I guess, I mean, in terms of accessibility, it's also about the digital divide. And I guess that there are going to be sectors of the community who won't have access to this type of...
Yes, the good thing is that it's not a game that you need to go to any, you know, Play Store or, you know, platform to download. It's web browser based. You need to go to your browser and you can play online, and it works in Chrome and different kind of browsers. Of course, you need a device. In this case, it can be a computer, mobile, or a tablet, and of course, you need a connection to the internet. But you don't need to download and set up anything in your device.
Okay, that's great. Thank you.